the extravascular, what happens if you administer the drug? It is a IV dose we have seen. The extravascular route like the oral, IM, subcutaneous, and the drug is distributed according to two compartment model. The rate of change in the drug concentration in plasma is described by three components. Suppose you are administering the dose as the IM, oral, especially oral route, IM and subcutaneous, because many of the drugs are given orally because it is ease of administration, etc. Of course, the IM and subcutaneous route also there is a possibility of lesser absorption or late absorption. Then K alpha is an absorption exponent in this formula. There is alpha is a distribution exponent in the graph you have seen. Beta is an elimination component. See here you have seen that here Ka is the absorption exponent. This is the absorption phase here. This is the absorption phase, whereas in case of the bolus injection there is no absorption phase, whereas in case of the oral route or intramuscular route there is a absorption phase. Maybe it depends upon, it may be short or more. Then it is the distribution phase and elimination phase. So another compartment is the elimination component will also be there. First absorption, distribution, elimination. So this is also depicted here. The Ka and alpha and beta type of the curves are noted here. And the same thing, the alpha and beta phase are depicted in some other type. Alpha phase is the distribution phase and beta phase is the elimination phase. So the drug, whenever it's given the IV dose or any dose, it will be distributed to various tissues, and the logarithmic concentrations, if it is plotted, it will look like this thing. Whereas this first phase is the absorption phase and the distribution phase, alpha phase or the distribution phase, and beta phase is the elimination phase. So usually such type of the drugs will follow two compartment models. And in case of two compartment models, the blood, there will be equilibrium between the blood. See here K1 and 2, it is noted as the first compartment. Blood is a first compartment, whereas the tissues are the compartment 2. So it is moving this direction, whereas from the reverse direction it is also K21. So the total concentration will be the K2CB. And now it is another thing is there, three compartment open models. The pharmacokinetic behavior of some of the drugs which have high affinity for a particular tissue or undergo redistribution, and that's the best interpreted according to a three compartment open model. Drugs which never undergo any biotransformation, the drug which undergo no biotransformation will follow the first one compartment open model, whereas the drugs which undergo the biotransformation will undergo the two compartment open models, whereas the drugs which have got the redistribution property. So the example is the lead is redistributed into the bone tissues, whereas the barbiturates are distributed into the fat tissue. So this component is referring to such drugs which follow the redistribution. So this is best interpreted according to a three compartment open model. In this compartmental model, body is conceived as consisting of three compartments. One is central and two compartments, two peripheral compartments. So we will see what is that. The central compartment is also noted as compartment 1 and comprises of plasma and highly perfused organs. Then the compartment 2 comprises of moderately perfused tissues like skin and muscles. Very like, see here skin and muscles do also have the what you call as the perfusion of the blood, but when compared to the central compartment, it is less. Whereas the compartment 3 comprises poorly perfused tissues like bone, teeth, ligaments, hair and fat. All these compartments or the tissues in the body do have very less performance, what you call as the perfusion. So the compartment 1 has very high perfusion, followed by the compartment 2, whereas the compartment 3 is having very poor perfusion. So if a drug is administered in body by intravenous bolus, any drug with such capacity or any drug with such what you call as the nature, if it is injected as a intravenous injection, it is first it is distributed immediately into the highly perfused tissues. That's the compartment 1, that is kidney, liver, brain, etc. That's the highly perfused organ. Whereas then they moderately perfused into the second compartment, like the skin and bone and muscles, and thereafter very slowly to the poorly perfused tissues. As the time increases, they are also distributed to the third compartment. Then if a plasma level time profile is plotted on semi-logarithmic graph, it gives a tri-exponential, whereas it is bi-exponential in 2 compartment open model, whereas it's a linear in case of the 1 compartment open model. So all these things please remember very carefully. So usually the drug undergoes all these fates, especially in this thing. The intravenous injection is given, then it's attained to the circulatory system, then it is going to be distributed in the tissues which are having the highly perfused organs. That's the compartment 1, then followed by the compartment 2, the skin and muscles, then lastly the very less perfused organs like the bone, the teeth, etc. Then ultimately they will be eliminated from the body after all other processes. So here you can see that here there are the central compartment, the kidney, then the liver and the brain. They are all the organs of the central compartment. So here you can see the equilibration between the drug and the central and peripheral compartments. Maybe it's a peripheral compartment 1 or it may be a compartment 2. So what happens whenever the drug is administered, there is equilibrium is established between the rapidly equilibrating component and slowly equilibrating component. So or else we can call as the compartment 2 and compartment 3 with that of the central compartment. So whenever a concentration of, suppose you administered the drug 1000 milligram to a person weighing for 60 kg, then entire 1000 milligram will be in the blood for a very short time. Then there will be formation of the equilibration because of the concentration. Here the movement of the drug from the compartment 1 to compartment 2, that's K12, whereas the reverse is called as the K21. Then the distribution of the drug from central compartment to slowly equilibrium compartment or compartment 3 is K13. Then the reverse is K31. So K10 means it's the site of the effector site. Suppose there is a what you call as the effector organs like the kidney, or the drug is going to act on the heart. It is known as the effector site. There are also some drug need to be what you call as the drug need to be penetrated. So that is effective site is known as the V0 or K10. That's very important to see that at this particular place where the drug need to be reached, the concentration of the drug need to be optimum. It's also known as the minimal effective concentration, or the minimal effective concentration is the one, it's a place of the body in which the drug reaches to a minimum extent so that the receptors or the enzymes or any other components of the body do respond to the drug. Suppose then you are administered the drug diazepam to the animal, then after plasma protein binding, then what you call as the volume of distribution, etc., it is going to pass the blood-brain barrier and going to act on the dopamine 2 type of the receptors. So that is the effective site here, effect site. So this is, all these need to be having a equilibration here. You cannot avoid the drug, not to go to the other organs like the skin, etc., because it is depending upon totally on the chemical nature of a drug. A drug may be highly lipophilic in nature, highly hydrophilic in nature, or highly plasma bound in nature. So all these things will make the drug concentration to be effective site or target site. That is very, very important to maintain the concentration of the drug in the effector site. And here also, this is about the oral dose absorption. Here oral dose, oral absorption rate. Here also there is a rate. After sometimes half an hour, the central compartment will be reached in the drug concentration. Then simultaneously the metabolic clearance as well as the renal clearance, they start immediately, and there is a movement of the drug between central compartment to peripheral compartment 1 and peripheral compartment 2. So this is the usually the same chart what we have explained in the earlier. There are 3 compartments in the body: highly perfused compartment 1, or it's also known as central compartment, whereas the less what you call as the perfused organs like the kidney and muscles, that's the compartment 2, and still less perfused organs like the bone and the other tissues, especially the dental tissues, etc., in which the concentration of the drug is very, very minimal. So this is the diagrammatic representation of the 3 compartment open models.